Well, good afternoon, everybody. I am very delighted to speak with you today. I wanted to thank Dr. Grant for inviting me to share my work with you today. And also I wanted to pay tribute to Patrice and her team for organizing such an amazing conference. And I already learned a tremendous amount of knowledge from colleagues and, of course, our patients, and made many meaningful connections throughout the conference. So I'm very grateful for my experience here. And I know that I already have 2 cheerleaders for my talk over there. So I'm super, super thankful for that. Well, as Dr. Grant mentioned, I'm an imaging scientist, and I enjoy collaborating with neurosurgeons, radiologists, and of course, our patients in a team science spirit. And I believe that innovation solves problems, and I'm always interested in applying the latest technology to improve our patient care. And at the same time, I'm also passionate about science communication, and I love presenting our research to patients and families to enhance the social impact of our studies. In fact, towards the end of my talk, I'm going to invite all of you to participate in one of our science communication activities. Now, in our meeting this week, we've learned a lot about many challenges in diagnosing and treating Chiari malformation. And I believe that these challenges also present many opportunities for us to develop novel technologies to improve our patient care. Therefore, in my talk, I would like to share some interesting results from our recent studies using advanced MRI imaging technologies to reveal previously hidden brain motion in Chiari patients that may enhance diagnosis. And then I'm going to share some latest trends in artificial intelligence in medicine and tell us how we can apply AI to predict treatment outcomes for Chiari patients. So what do I mean by hidden brain motion? Well, we may not think about it very often, but our brain actually moves. And this movement turns out to be quite important in keeping our brains healthy. Now, to explain this principle, let's actually look at the beating heart. Now, as we learned from Dr. Yang's lecture on Tuesday, we can use a cine MRI to produce a movie like this for a moving system in our body, in this case, the beating heart. Now, actually, if you ever had an MRI scan while wearing a pulse oximetry on your fingertip, it was very likely that a cine MRI scan or a cine MR movie was acquired because this technique actually involves taking images at constant points in the cardiac cycle. This allows for clear visualization of the anatomy of interest. But did you know that with every heartbeat, our brain has a corresponding movement or pulsation? And our brain movement is actually driven by 2 forces. Now, when the heart pumps blood, it sends out a stream of blood through the arteries. And this stream creates a small pulsation, very small, very tiny. But it can actually cause the brain to move a little bit. And this motion is often described as cardioballistic motion in the literature. Now, our heartbeat is one of the main sources that drives brain motion. And there's also a second force, that is the CSF flow. Now, as we have learned in many previous talks, CSF is produced in the ventricles, and then it flows to and surrounded the brain, which is contained by the arachnoid. And now, as CSF constantly circulates around the brain and the spinal cord eventually, the movement also creates a subtle and a small pulsation of the brain. So therefore, both the arterial pulsation and CSF flow can trigger brain motion. Now, how big is the brain motion? Well, here in this study, a team of imaging experts took an MRI scan in a healthy brain after each heartbeat. And the color map here shows the displacement or the movement of each pixel in the image. And of course, yellow here indicates larger motion or larger displacement. And we can see that pixels near the cerebellum often have the strongest motion or the highest degree of motion. However, if we look at the number here on the color scale, the amount of motion is only about 0.15 millimeters, which is about the diameter of our hair. Now, another limitation of this technique is that it nearly took 20 minutes for the researchers to acquire images like this because the motion is really too small to be imaged. Therefore, this is not a practical technology for our clinical applications. Now, since the motion is focused near the cerebellum, an interesting question then would be, what does brain motion look like in Chiari malformation patients? Because we know that in Chiari patients, there's an obstruction in the cerebellum, which is a major pathway for the CSF flow. Now, as we have seen earlier, since we can use cine MRI to detect cardiac motion, can we use a technology like this for brain motion in Chiari patients? Well, the answer is yes and no. So here we are looking at two movies side by side from a patient with Chiari malformation and a normal control subject. And I hope you can see that it's actually not a static image, but it's a movie. And each frame in this movie was taken after each heartbeat. Obviously, we can hardly see any brain motion here. But we know, as we explained previously, that there is motion. Therefore, it's hidden. Now, using advanced signal processing technologies, our team developed an exacting technology to amplify the brain motion at sub-pixel level to reveal the hidden brain dynamics in Chiari patients as well as normal controls. And we found that Chiari patients often exhibit larger motion than normal subjects. Now, if we think about the underlying biomechanics, this actually makes sense because the brain needs a stronger force to overcome the barrier caused by the herniation of the cerebellar tonsils in Chiari patients, therefore a higher degree of motion. Now, another advantage of our technology is that it can be easily implemented in nearly any existing MRI scanners, and we were able to acquire and process these type of movies within 5 minutes. Now, we took a step further to compare the amount of amplified motion quantitatively, and the difference between the pre-amplification and the post-amplification give us this heat map, which tells us the amount of motion in each pixel after amplification. And the heat map, as we can see, of Chiari patients showed increased midbrain tissue displacement and also superior-inferior displacements near the cerebellum. So these findings actually support the principles of impaired biomechanics at the brainstem and the cerebellum in patients with Chiari malformation in many previous studies. Now, on a group level, the amplified motion in patients was also significantly higher than in controls, although with a much larger variance or difference. So this is exciting because we believe that we can use amplified motion as a novel imaging marker to identify patients with Chiari malformation and eventually studying the biomechanics of their CSF flow. Of course, our data opens up numerous interesting questions. For example, since many Chiari patients need decompression surgery, a natural extension of this study is to examine the pre- and post-surgical amplification motion of the brain and even the spine. So from what we learned, we expect that amplified MRI will reveal similar brain and even spinal dynamics in many other pediatric brain diseases, such as brain tumors, hydrocephalus, tethered cord, which we talk about a lot during the conference, and many other malformations. And we can also apply this technology beyond pediatric brain diseases. For example, on the first day of our meeting, we discussed briefly about CSF dynamics in patients with dementia and Alzheimer's disease. So I wanted to make a small remark here on how amplified brain motion can be used for diagnosing AD or dementia. Now, nowadays, amyloid PET imaging is one of the most sensitive techniques to detect early onset of dementia. However, most insurance companies do not cover this type of procedure. And of course, PET scans expose patients to radiation. So here our colleagues applied the amplified brain motion technique to AD patients and found something really interesting. So here the color map again represents the amount of motion in different directions. So on the top row, we can see a amyloid negative subject or a normal subject without dementia. We can see that the amplified motion in this normal subject appear to be quite homogeneous throughout the brain. And on the bottom row, which is an amyloid positive patient, which is or AD patient, the amplified motion in this patient appear to be more focused or concentrated than in the normal subject. Therefore, we believe that amplified motion has the potential to replace amyloid PET imaging as a surrogate for early detection of dementia. Now imagine the future where predicting treatment outcomes for brain diseases is not just a simple guessing game, but a precise science. What if we could reduce the uncertainty and anxiety associated with neurosurgeries? Now we believe that by integrating AI and neurosurgery, we'll be able to improve treatment outcomes and pave the way for personalized medicine. Therefore, in the second part of my talk, I wanted to show you some exciting trends in imaging research using AI to predict treatment outcomes for neurosurgical procedures. Now, as many of us know, a classic example of AI is that it can help computers to tell if a picture is a cat or a dog by looking at some important features of the animal, such as their ear, their fur, and nose. And the AI algorithm actually learns to recognize these features. And once it learns, it can look at a new image and say whether that's a cat or a dog. And nowadays, AI can not only recognize pictures like this, but also make predictions and even disease progression. So our team has done some interesting work on applying AI to help neurosurgeons to predict treatment outcomes for pediatric stroke patients. Now the images, the brain scans on the left shows the MR scans taken from a pediatric moya patient before their bypass surgery. And using data from over 200 cases, we trained an AI system to predict tissue outcomes as well as neurological outcomes after the patient's neurosurgery or the bypass surgery. What you can see on the right is the AI-generated images that tells us their blood flow and also the transit time of these high-risk stroke patients. And also our AI model also was able to generate a modified ranking scale, which reflects the expected neurological outcomes. Another example of AI in neuroscience is to predict brain development using brain scans. Now, myelin maturation is an important process that drives brain development during the first 3 years of a baby's life. Now, currently, only experienced pediatric neuroradiologists can identify key features on brain scans to determine a baby's myelin maturation process. So here, a team of AI experts developed an AI algorithm to predict the myelin age using thousands of brain scans that are publicly available from healthy babies. And this algorithm can be applied to new scans to determine the corresponding myelin age. Now, what's interesting about this technique is that if the predicted myelin age, let's say, is 2.5, 2.5 years, while the patient's actual biological age is 3 years, for example, then there might be some problems related to the delayed brain development of this patient. So how can techniques like this help our patients with Chiari malformation? Well, an important strength of AI that we have not explored is this ability to integrate different types of information from different sources. And I believe this will work particularly well for medical problems because we have imaging data, demographics, lab tests, clinical notes, and even data collected from wearables technologies, such as our Apple Watch. Now, an interesting aspect on this diagram that I would like to highlight is this concept of digital twins. Has anyone interacted with your digital twin, if I may ask? Well, I'm not offering a matchmaking service here. Well, you can watch this TikTok video to learn more about digital twins. But in essence, our digital twin is a virtual representation of ourselves. And we can use a concept like this in medical applications. Now, using AI and thousands of publicly available brain scans from healthy individuals, my student developed a set of synthetic healthy brain scans that can predict baseline brain health based on their age, sex, and structure. In other words, a healthy digital twin for each individual. Now, as many speakers in our conference highlighted, we know very little about what normal looks like for many pathophysiological conditions in our pediatric brain applications. Therefore, studies like this will be able to provide answers because knowing what healthy looks like, it is much easier to identify abnormalities and make diagnosis. Coming back to Chiari Malformation, now we envision that AI can not only enhance our amplified brain motion technology that we have seen earlier, but also integrate multidimensional data to make accurate and reliable predictions for treatment outcomes and disease progression for Chiari patients. And as Dr. Grant and many other speakers mentioned, there are many open questions for us. For example, what risk should we anticipate after decompression surgery? And what about the timing of intervention? And we believe that AI will significantly enhance our current clinical workflow to optimize treatment outcomes. And we are currently developing a lot of foundational models and looking for seed funding to support our research. And after hearing from all the experts in our meeting, I realized how complicated Chiari Malformation is. Therefore, in the panel discussion later, I would love to hear more from you. I would be happy to discuss with you with what specific aspects of Chiari Malformation that AI can contribute to. Now, in summary, we discussed a novel technology to reveal hidden brain motion in Chiari patients. And we saw that the amplified brain motion in Chiari patients is significantly larger than in normal controls. We also explored the potential of AI in predicting treatment outcomes and many other pediatric brain applications. Well, as we close, I have an extra resource to share with you. Now, as I'm passionate about science communication, we have a podcast channel on Spotify to discuss how we translate our research to improve patient care. And I invite you to scan this QR code to listen to our programs. And since September is Chiari Malformation Awareness Month, we would love to make a special program on Chiari Malformation. So please contact me if you'd like to participate. Thank you very much.